Childhood Obesity, The Effects of Educational Intervention, a podcast by Jackie Taub. Historically, a fat child meant a healthy child. Fat demonstrated the ability to survive malnourishment in a growing world. More recently, however, cultural changes have contributed to excessive weight gain, which has become a primary childhood health problem in various areas of the industrialized world. The percentage of overweight children in the United States is growing at an alarming rate, with 1 out of 3 children now considered overweight or obese. Since 1960, the prevalence of childhood obesity in the United States increased dramatically from 5% to 16.9%. This chart shows the prevalence of obese individuals between 2009 and 2010. Among 41 million women and more than 37 million men aged 20 and over were considered obese. Among children and adolescents aged 2 to 19, more than 5 million girls and approximately 7 million boys were considered obese. So what exactly does it mean to be obese? Obesity is defined as having excess body fat. As methods to determine body fat are difficult, the diagnosis of obesity is often based on BMI. With health issues like diabetes, heart disease, asthma, hypertension, cancer, and sleep problems all closely correlated to obesity, the disease is associated with 300,000 deaths each year and will soon overtake tobacco as the leading cause of preventable death. Recent studies of the physiology and molecular genetics of obesity in humans have provided evidence that body weight or fat is regulated. One study found that some of the genes encoding the molecular components of this regulatory system have been isolate. The increasing prevalence of obesity represents the interaction of these genes with an environment that encourages a sedentary lifestyle and consumption of calories. The rapid increase in the prevalence of obesity emphasizes the role of environmental factors, because genetic changes alone could not occur at this rate. In the United States, it can be said that we live in a toxic environment. Environmental factors impeding healthy eating include socioeconomic status, limited access to healthy food choices, poor neighborhood characteristics preventing the ability or desire for physical activity, and advertising that bombards youth with unhealthy choices. Schools play a particularly critical role by establishing a safe and supportive environment with policies and practices that support healthy behaviors. Schools can also provide opportunities for students to learn about and practice healthy eating and physical activity behaviors. With that being said, the question being addressed today is, do schools play a significant role in reducing childhood obesity? Because the majority of young people aged 5 to 17 years old are enrolled in schools, and because the amount of time that children spend at school each day, schools provide an ideal setting for teaching children and teens to adopt healthy eating and physical activity behaviors. One study sought to assess the efficacy of a school-based intervention program to reduce the prevalence of overweight and obese children 6 to 10 years old. In their study, 3,135 participants from 10 schools were assigned to either an intervention or control school. In the intervention schools, low-fat dairy products and whole grain bread were promoted, and all sweets were eliminated. Also, physical activity was aimed to be increased. This chart shows the results from the study. Researchers found that the prevalence of overweight and obesity decreased by 3.2% in intervention schools, compared with an increase of 2.8% in control schools. This chart shows differences in proportions between intervention and control families and unhealthy eating habits. Families with children from intervention schools reported healthier eating habits at home, such as decreases in high-fat dairy products, compared with those children in control schools. The results of the study indicate that a school-based intervention can reduce the prevalence of overweight and obesity and may affect eating habits at home. Another study sought to determine if a school-based educational program aimed at reducing consumption of carbonated drinks could prevent excessive weight gain in children. The results of the study found that at 12 months, the percentage of overweight and obese children increased in the control group by 7.5%, compared with a decrease in the intervention group of 0.2%. This chart displays a mean change in prevalence of overweight and obese children from the study from baseline to follow-up at 12 months according to clusters. This study provides evidence that a school-based educational program aimed at reducing the consumption of carbonated drinks to prevent excessive weight gain in children ages 7 to 11 years old was in fact effective. The bottom line, schools do in fact have a significant role in obesity prevention in children. The urgency for effective childhood obesity interventions is apparent from the growing health, social, and economical costs associated with the rising rates of obesity. More focus is necessary in finding the specific genes and risk factors associated with obesity and finding more effective treatments. So what should we do? Implement nationwide school programs educating both children and parents and eliminate unhealthy foods such as sweets and soda. We should encourage family participation to continue healthy habits during breakfast, dinner, and after-school activities. Joint school and home interventions are a great starting point, but more research is necessary to solve this epidemic. There should be a more detailed analysis of the cost of obesity, disease treatment, and the cost of inaction. Healthcare professionals have a duty to be informed about the disease and to advocate for patients who need help. Registered dietitians can also be key players in delivering obesity treatment. The obesity epidemic is too large to be ignored.